Hello, my name is Ivanka. Today I'm going to talk about a topic that does not get enough attention, even though more than 50 million people experience it. Epilepsy. Epilepsy. Whenever people hear this word, they immediately think of a convulsion. Whenever a person falls to the ground and starts shaking violently. Another way that people also imagine it is the way that they portray it in movies, with foam coming out of the mouth. However, this isn't the only case. Epilepsy is like many other brain diseases that have many different reactions, such as the convulsion or falling deep in thought, unable to return back to reality. There are cases of people forgetting things that have happened to them a minute after they have actually happened and losing awareness to their surroundings. These are some of the reactions, but what is epilepsy actually? Epilepsy is an unwanted synchronous electrical discharge in the brain. For example, if the seizure strikes an area of the brain which corresponds with the hand is going to stiffen, and as it progresses into another area which has to do with the jaw is going to move. Another thing super upsetting about epilepsy is that the seizures are completely spontaneous. They don't go in any patterns or follow any patterns. The seizures, they affect the whole brain at once. While others, they can start in one section, rapidly spreading to the other. Chaotic, like a fire. Any person is prone to having epilepsy, not depending on gender, age, or race. The cause of epilepsy ranges from genetic disease to brain damage. However, for 70% of the patients, the cause is unknown. This makes epilepsy immensely tough to treat. When common medications such as phenobarbital and dalantine that work by suppressing or blocking either chlorodynes or sodium channels to reduce the accessibility of the brain stop functioning, people go to drastic measures to stop it. Many people are so desperate that they're willing to risk their life for the chance of even curing it partially. They endanger themselves to huge side effects, but their wish to get rid of it is so enormous that it obscures the danger of them. Some people tried brain surgery, marijuana, extreme diets, commonly a high-fat, low-carbohydrates diet, also known as the keto diet, vagus nerve stimulations, and illegal drugs. When older people with epilepsy go for neurosurgery, their brain will heal longer because the grown adult human brain has neurological plasticity and can adapt, even though a lot worse than in infants. People try, and sometimes it works, others it doesn't. All seizures begin with extra electricity in the brain. The cells are communicating too much. Before a seizure, the body gives warning signs, like the fire alarm before an actual fire. And when it begins, it usually lasts from 1 to 2 minutes. If it's over than that, you have to find a way to cope with it. Call 911. Do something. If you're a child, find an adult. Deja vu and butterflies in the stomach can be mild results of epilepsy. During a seizure, become discolored, floating. Patients hear noises and see glimmering lights. Epilepsy along the decades. Epilepsy was known as the sacred disease. In the Bible, Jesus cures a boy with seizures by getting the demons out of him. In the 20th century, there was a law to forbid people from marrying and had to undergo sterilization. It is amazing how things have changed, and people treat epileptic people with respect and care. If you meet an epileptic person, please be nice to them. Please treat them with respect. They are already going through a lot. Today I'm going to interview a scientist at the Gladstone Institute that studies epilepsy and Alzheimer's disease to educate us deeper about this fascinating but terrible occurrence. Yulia Voskovinik.
Hi everyone.
So I wanted to start off by asking this question: what is epilepsy?
So epilepsy is a debilitating disorder, neurological disorder, that is usually defined within medical professions and scientists as a spontaneous, unprovoked, recurrent seizures that happen to the patients. And there are multiple forms of epilepsy where it's a disorder on its own, but also as a comorbidity disorder.
I also wanted to ask, is there a specific reason to why I chose to continue with this topic?
So I got interested in the world of science related to medicine a while back. When I finished high school, my grandmother got a diagnosis of Alzheimer's disease and died shortly after the diagnosis due to the debilitating disorder. I have multiple family members that have had stroke and post-stroke epilepsy developed. So I got very interested due to personal reasons in both the epilepsy and neurodegenerative disorders.
And I also wanted to ask, specifically, what do you do for work?
So I'm a scientist, so my day-to-day doesn't look the same every day. Usually we have multiple topics and multiple projects that we work on, and specifically right now I work in the lab of Dr. Jean Paz within Gladstone Institute, affiliated with the University of California in San Francisco. And our main topics in the lab and projects in the lab, especially the ones that I'm involved in, are within the world of genetic epilepsies, but as well as the epilepsy co-occurring in the neurodegenerative disorders, and for me specifically, Alzheimer's disease. So day to day, I write papers, I write science papers, I write grants to the National Institutes of Health to receive money to perform our research. I design and perform experiments. I analyze the data, and then I visualize the data. I discuss it with my peers and with my supervising staff, and we discuss our findings, and then we report it to the world in the form of science presentations, science talks, poster presentations, formal peer-reviewed publications in scientific journals, and interviews like these.
And in what way does that help doctors and other scientists, improve on curing epilepsy and treating it properly?
So one of the main reasons why epilepsy field is still very developing and involves so many scientists working on it is due to the fact that not all epilepsies are created equal. There are multiple forms of epilepsy, including neurodevelopmental and neurodegenerative and post-injury epilepsies. And each kind of epilepsy has its own flavor. There are multiple FDA-approved drugs right now that epileptologists or clinicians or clinicians that are seeing these epilepsy patients are starting with as a treatment option with a patient who has been diagnosed with epilepsy. However, not a lot of the patients are responding well to these medications. And usually it's due to the fact of what is the cause of the epilepsy in the patient. For example, if it's a neurodevelopmental genetic disorder, these patients have different mutations that might respond differently to different medications. And therefore, new treatments need to be developed to actually tackle the specific epilepsy that the patient has.
And you said post-traumatic epilepsy. Is that the epilepsy that, for example, a soldier came from war and got a huge head trauma, and that could cause epilepsy, but in what way?
So post-traumatic epilepsy is also its own subfield of epilepsy. Post-traumatic epilepsy can happen not only due to head trauma, but it can also happen to any of the acute injury to the brain, and that includes stroke as its own special type of injury. These kind of epilepsies, post-traumatic epilepsies, have their own mechanism of action and how they are developed within a patient. Not every person who gets brain trauma is going to develop epilepsy. However, a lot of patients, and especially a lot of soldiers who have received a strong traumatic injury to the brain do develop post-traumatic epilepsy. So what is the cause of it? Any kind of trauma to any of the bodily tissue can have its own effects on the body. For example, if we injure or if we cut our skin, we have some local inflammation that's happening and it's painful, and we have a lot of the immune responses to regenerate the tissue. It's a little bit more complicated with the brain because our brain cells, the majority of the brain cells are post-mitotic, which means they do not regenerate similarly to how our other cells in the body regenerate. So any injury to our neurons, brain cells, actually are, the majority of times are permanent. So we cannot repair the trauma that has happened, especially to the soldiers, and therefore the lack or the injury to the neurons that happened during the trauma can induce any of the imbalance in the brain electricity that we can assess electrophysiologically as clinicians and as scientists. Therefore, the post-traumatic epilepsy is a hot field in science to develop better treatments for our veterans especially, and would be very efficacious for a lot of other types of post-traumatic epilepsy.
Does brain surgery help? Because I read that during brain surgery, a patient, which is an adult, it might work, but brain plasticity, the neuroplasticity, it's not as good as a child. So would that affect the way that the patient is going to heal, it's going to be treated?
So brain surgery to remove a locus of a specific locus where epilepsy is starting, or a focus or focal point where this epileptic activity is happening in the brain. The brain surgery is used for the treatment of some of the epilepsies. Usually those patients undergo a series of different treatment options first. And if none of those treatment options work, the last resort for a caring team, for epileptologists, clinicians, and for neurosurgeons is to develop the treatment plan where they would resect the tissue from the patient that is the cause of this epilepsy. The best results are, as you said, are happening in young patients because the brains are very plastic and other neurons are able to take the responsibility of other neurons that have been removed from the brain. Some of these surgeries do happen in adults as well, and it depends patient to patient of how these patients respond to such kind of treatment. In other cases, for example, in post-traumatic epilepsy, when is surgery used then? A lot of times, brain bleeds happen in the post-traumatic patients where an artery or a capillary was injured to the point where it accumulates a lot of blood in the brain. In that case, the best case scenario if after that trauma, and usually it's hemorrhagic stroke that occurs after trauma, if that bleed is removed away, so there's no more injury to the brain and less likely that the epilepsy will develop.
And I also wanted to ask, how do you feel when encountering patients? Even though there are not as many patients because you work as a scientist and not as an epileptologist, but still, even though you receive fewer patients, how do you feel?
So it is an absolute privilege and a huge trust that we receive from patients to develop treatments for them, to work on the diseases that they suffer from. So I feel absolutely privileged and thrilled to be involved in developing better treatment options for these patients. Second, I'm very humbled by the fact that there are not as many treatment options for a lot of the epilepsy patients out there. And the amount of trauma, the amount of stress that the family is undergoing while suffering from this debilitating disorder, not only physically and mentally, but also financially, is extremely upsetting. So to understand the fact that the need for developing better treatment options is in our hands is very important. So there's a lot of responsibility when it comes to both for clinicians and scientists to work hard and try to develop better treatment options.
I also read that marijuana was used to treat some patients from epilepsy. How would that possibly help cure epilepsy? Would some of the drugs that are used to treat epileptic patients have similar ingredients?
So currently, to my knowledge, and the field is still performing a lot of research to understand the effect of especially CBD on the treatment of epilepsy patients. I'm not 100% sure about whether marijuana itself is helping into what patient population. As I said, epilepsy is a very large field, and different epilepsies are treated differently. But I do know that a subset of patients do receive CBD treatments, but those have to be seen by special epileptologists that work specifically with those patients and families.
But since most drugs that are illegal are banned, how come patients still undergo such drastic measures to heal themselves? I understand that epilepsy is a huge disease and it impacts their life highly, but why would they go to such drastic measures to, for example, to the black market to go fish for illegal drugs to save themselves?
Usually, in my personal opinion, these people are extremely desperate. When a person suffers tremendously from a debilitating disorder, they do seek out illegal ways to hopefully treat themselves. Unfortunately, clinically proven drugs are usually available through the clinic and through epileptologists in the clinic. And usually illegal drugs are not helping at all to these patients. So the lack of education or proper understanding of the mechanisms of epilepsy and extreme suffering that these patients are going through might be driving them to do some of these things. My recommendation: always work with healthcare providers, with epileptologists, with clinicians, seek second opinions, and get as best treatment as possible. Again, with traditional medicine that has put an insane amount of time, money, and brilliant minds to figure out what's the best treatment option for epilepsy patients.
And returning back to one of the reactions of epilepsy, the convulsion. If a person starts experiencing an epileptic seizure, what would be the best measure to go to? If you're alone, stranded somewhere, and you just have to take care of that person because nobody else is around, what would be the best thing to do?
So there are two routes. First, if the person is the one that you know and a family member or a person that you help to take care of, go ahead with the treatment plan that you have developed with a clinician or a caring team in place, and that would be the best option to do. The second option is when you do not know a person and you see a person usually convulsing and you suspect that the person is having a seizure, the first step is to call 911. You do not know the condition that the person is undergoing and whether the person has some acute trauma that has happened and whether a person needs immediate health care that has to be provided to the patient. So call 911 right away. If you do not have a phone, ask for help if you have people around. In the case that a person has fallen down and likely has a seizure and has trauma, especially in the form of bleeding that you see, again, call 911 right away and seek for help. If you're not an adult and if you're a child and who sees such an occurrence, absolutely ask for help of adults and to get immediate health care to be delivered. There are multiple kind of misconceptions of what to do to a patient when they're seizing, and some of the older misconception is to put something into the person's mouth to make sure that they do not clench their teeth. The current recommendation is not to do anything to a patient except maybe to tell them that they're on their side, and that's about it. There's nothing else that you, as not a healthcare professional, that can provide help to a patient. So 911 is the best case scenario.
So messing around with the mouth to make sure that the person does not have anything in their mouth and to take out the tongue so that they don't possibly choke on their tongue. Sounds wild, but it would be considered a myth, correct?
Currently in the healthcare profession, yes, because what can happen is you can actually injure yourself and injure a person while performing such kind of measures. So usually if a person is seizing, they're unlikely to have anything in their mouth, and they're seizing and convulsive kind of in waves. So usually the seizure seizures are not long, and the person will seize for a few minutes, and the seizure will stop, and then the patient will just lay down fatigued or completely wake up and be able to stand up. If a patient seizes for a prolonged period of time, that's when healthcare has to be provided to them immediately, because they can reach what is called a status epilepticus, which is a phenomenon in epilepsy where the brain might not receive enough blood or oxygen, and secondary neurodegeneration can happen because of that severe seizure in the case. So again, the best case scenario is to have an emergency personnel to be on site as soon as possible.
So a normal seizure lasts from 1 to 2 minutes. So that would be the usual 10-minute seizure lasts, and if it lasts over 5 minutes, that would be a good time to call a healthcare professional.
So it depends from epilepsy to epilepsy. Different epilepsies, genetic, the ones associated with neurodegenerative diseases, or post-traumatic, have different time courses for each seizure. Each seizure is not created equal. Some are convulsive, some are completely silent. Some include loss of consciousness, others do not. So the length of each seizure will be different depending on the epilepsy and depending on the seizure type that is expressed in that patient at the moment. The longer the seizure, usually there is a higher likelihood of injury to the patient's brain. But usually, in case that the person is having a seizure and it's a stranger person on the street, and you do not know the duration that the person was seizing, nor the treatment or care that has to be provided to a person, best case scenario is to call 911.
And regarding the silent seizure, the one where people usually lose awareness or get lost deep in thought, would that damage the person's brain even though there's no physical reaction showing that they're damaging the brain?
So any epilepsy is not good for the brain. So that's why it's a disorder that has to be treated. A person with having just spontaneous recurrent seizures that are not controlled is always bad for the brain. Therefore, we are researching these better treatment options for those patients who do not respond well to the FDA-approved drug right now. About the silent seizures, the silent seizures are even subdivided even more to those that do lose consciousness and kind of are lost in their thought, or they're called staring spells, where a person is just looks like they're staring at something, but they're completely non-responsive to you for a very brief period of time. So these are called, with the staring spells, these are called absence seizures, and the absence seizures are the ones where a person does not understand what is going on during that brief period of time. And it's a form of genetic epilepsy as well in most cases. So absence seizures are usually responding well to the absence seizure specific medication that's approved by FDA, but some of the absences are not as well responsive. So that's why even in our lab we're developing better treatment options for these patients. And on the other hand, the other side of these silent seizures are a particular case, for example, in Alzheimer's disease, where these non-convulsive silent seizures occur even with a person not really having awareness that they are happening. So there are no staring spells occurring. There's not a classical absence seizure where a person loses consciousness or get lost in their thought during the period. But these epileptiform activities or epileptic spikes that are happening in the brain are still occurring in these Alzheimer's disease patients. And it is more and more recognized in Alzheimer's disease field that this is a phenomenon that also requires treatment and is a potential phenomenon that can contribute to the more severe outcomes of Alzheimer's disease.
So from what I've understood, that epilepsy and Alzheimer's disease, they're super, super close together and they're super similar.
Yes and no. So a lot of the patients, especially later on in Alzheimer's disease, some of the Alzheimer's disease pathology is brain neurodegeneration. If you have decreased, if a patient has a decreased number of neurons to start with, there's imbalance in how the neurons are communicating with each other. And any change in the communication can, between the neurons can induce the electric activity that can spike these epileptiform activity. Alzheimer's disease as a primary disorder of the patient is usually much more robust than the epileptic activity associated with Alzheimer's disease. So epilepsy on its own, when diagnosed, as I said, it's spontaneous unprovoked recurrent seizures. It's a much more robust disorder on its own that might have its own comorbidities in any shape or form of other neurological symptoms and problems.
So the Alzheimer's disease is similar to the section of the epileptic reactions diseases that affects the memory loss side of the brain and the silent.
So Alzheimer's disease is a neurodegenerative disorder that usually occurs later in life in more elderly patients. And the main clinical phenomena of Alzheimer's disease diagnosis is the loss of memory. And the loss of memory happens because the region of the brain called hippocampus is usually the first region to degenerate in Alzheimer's disease patients. So as the hippocampus, this focus of a lot of the memory activity, the memory information activity, is degenerating, a patient cannot recall some of the newly acquired information and some of the older information. So they start losing this ability to recall. Again, why are these silent epileptiform activity happening in Alzheimer's disease brains? I don't think anybody knows yet, but this is an active area of study, and whether and how it affects the progression of Alzheimer's disease, and whether some anti-epileptic treatment can help for the disease progression to slow down and for the memory loss to stop is currently in the clinical trials.
So, from what I've understood, that epilepsy is an ongoing disease that has many different sections to it. And Alzheimer's disease is a bit more narrow.
Alzheimer's disease is also considered a syndrome that involves a lot of the different dysfunctions that are happening to the brain. And similar to epilepsy, it has its own flavors, it has its own different versions of epilepsy. So I would just consider them as two different neurological disorders, both extremely debilitating both to the patient and the family that is taking care of them. Both of those disorders, both epilepsy and Alzheimer's disease, require new treatments, better treatments, and better care for the patients that undergo this disease.
And Alzheimer's happens more towards to an elderly patient, towards when they're an adult. And epilepsy can happen at any age.
Exactly, because epilepsy, there are different types of epilepsy. There are both neurodevelopmental, post-traumatic, and now neurodegenerative diseases are also having comorbidity in the form of epilepsy. Alzheimer's disease usually develops to the elderly. There are some forms of early onset Alzheimer's disease, but yet it still happens in adulthood and not during the childhood. So it's just a different disorder that the brain is suffering from.
Are there any possible things that might lead to epilepsy? For example, not getting enough of sleep or getting a possible head injury?
So from our understanding, any injury of the brain can precipitate in the form of epilepsy. So being careful and extremely being careful during contact sports, being careful not inducing self-inflicted trauma would absolutely help to decrease the cases of epilepsy. But that is usually not in our control for the traumatic brain injury that can precipitate epilepsy. For the genetic disorders, there's not really control for that. Getting enough sleep, having good nutrition, good food intake, and having a healthy lifestyle just overall protects our bodies, not only from neurological disorders, but any other type of disorders. So eat healthy, sleep healthy, and lead a healthy lifestyle to avoid any kinds of disorders. disorders happening to the body.
So as Yulia said, eat healthy, sleep healthy, and lead a healthy lifestyle. Thank you very much for doing this interview with me.
Thank you, Ivanka. It was my pleasure.
Even though the life of a person is highly impacted by their health, the life of that person doesn't differ from ours as much as is thought. To get to know about the daily life of a human suffering through this terrible disease, I'll talk to the daughter of a nanny who babysat a child having it. She stepped in because her mom wasn't able to do the interview for personal reasons. Olga Berchu-Quincy. Hello. She is going to let us in on the daily routine and actions to take during a seizure. So let's start. How long has your mom been working as a nanny?
For more than 20 years.
Was that her first encounter with an epileptic child?
Yes, it was. She hasn't had kids like this before.
Was there anything that her parents told you before she was set to work?
They informed her that the kid was diagnosed with epilepsy when she was only 4 months old, that one of the seizures just happened during the night, and this was the first seizure, and this was of course a very scary moment for the family. And after that the seizures started repeating once a week at least. So they did warn her, and they did show her where the medication is, which has to be given during the time of seizures, but also the girl was taking medication daily, twice a day. And this was also a part of her duty as a nanny, to make sure this medication is administered on time.
Was there anything specific that, what were the actions that your mom had to do during a seizure if the child had a seizure?
Well, she was instructed to call the mom if the mom was at work. Of course, she started this job when pre-pandemic, and the mom was still working from the office. So the instruction was to call the mom, and the mom was to decide if they should be calling 911. So that was the instruction she was given. Luckily, no seizures happened when my mom was alone with the baby girl. However, they did happen during the parents' presence, and it was a very scary scene to watch.
What types of seizures did the child have, or did she have only a specific seizure?
She had at least 2 types of seizures, and the ones that were happening during the night were called absence seizures. And this is actually what it sounds like. The child, the person who has absence seizures, becomes absent for a few seconds or up to a few minutes. They freeze, they have a blank stare, their eyes do not blink, and they become completely irresponsive. And for my mom, it was a very scary sight to see when this happened during one of the evenings that she was working. Luckily, the parents were present, but during that moment, the family did call 911, and the paramedics arrived and gave her some very strong medication, which brought her back. So this was the seizures that were repeating almost every night at some point. And therefore, the family installed cameras throughout the house to make sure that the child is monitored even during her daily sleep, basically 24 hours a day. The mother and whoever was watching the baby had to be looking at her and making sure they're not missing any seizures. The other type of seizures that were happening later on were different ones, where the baby's breath was suddenly becoming very short. She was breathing very rapidly, and she was feeling it coming. And she would run to my mom and would want to grab her very tight and just hold on to her for those couple of minutes that she was experiencing this seizure. And she would be breathing very heavily, she would turn red, and she would start pointing at her head, trying to say that the head was hurting. And these were the seizures that at some point started happening every half an hour. This was very disturbing for a child because she did not feel well at all.
So for the absence seizure, she did not feel it coming. She didn't feel the absent seizure at all.
This is the type of seizures which the person itself does not really notice. As far as I understand, this is the type of seizures when the person just loses consciousness for a few minutes and then suddenly comes back and the world around them might have changed. So when kids grow, they might simply say that they fell asleep for a few minutes and then suddenly they come back, they wake up. But this little girl started experiencing these seizures at a very young age, as I said, when she was about 4 months. So she, of course, couldn't tell what was happening, and this is not something that she could relate or describe. This was only something the parents could notice and provide help or call for help if needed, because as per doctor's instructions, she could come back out of the seizure on her own if it's up to 1 minute. If it's more, then it was absolutely necessary to administer the medication to bring her back.
And for the second seizure, she felt the seizure completely, since she came up to your mom and started pointing to her head saying that it hurts.
Yes. These were the moments, as my mom described, when they could simply be on a walk, just walking along the street or observing the world around them, or she would be showing her flowers and trees and some animals around, and the child would be very happy and interested and joyful, and then suddenly she would turn around, run to my mom, grab her very, very tight, and wanted to hold her with that very tight grip until the seizure passes. And after those seizures, she would actually become very cranky and tired and sleepy. So this would really prevent her from functioning normally during the day, because her brain suddenly would become so overstimulated that it could not function normally, and she would immediately lose interest in playing, in watching her favorite shows or observing animals or playing with her sister. She would immediately start showing to her head and saying it hurts and she wants to sleep, and she could only sleep for 20 to 30 minutes and then wake up, but this would make her definitely very tired and very cranky, unfortunately.
And another question, what was your diet and everyday routine? Did it differ from something that you might give your daughter or your mom fed other kids?
Well, actually, the mother of the girl did receive some recommendation from the doctor that kids like this are better functioning on a keto diet, which is usually excluding gluten and milk products. However, as far as I know from my mom, the family did not succeed into implementing that diet, because they had another child who was eating everything the family was eating, and the little one was watching her older sister and would want to grab the same things that she'd eat. And the family would eat as usual. Milk and gluten products, especially things like pasta, were among products they eat every day. And from what I understood, on the days that they did try to restrict her and not give her some pasta and cookies and other sweets or dairy products, she would become very picky. She would become angry that she's not getting her usual things. And I guess the parents decided that they cannot, they do not have enough of discipline or enough of strength to really implement those restrictions, and they were relying mostly on the medication, and they were consulting other doctors who were not making too much emphasis on the diet, that they were not stressing that this was a crucial element. Therefore, they did not try to change it. They were happy just to see the child eating anything, because during seizures, her appetite was very low in general. That's why when her appetite would increase and she would eat at least something, they were simply happy about that. So at the end of the day, they did not put her onto any special diet.
So did people treat her differently just on the street if they did not know that she had a seizure?
She looks normal. From the outside, she looks as a normal little girl, very cute, very delightful. There are no external signs about having epilepsy. Therefore, only the close circle of family members and friends knows that she has this illness, and that she should not be emotionally stimulated very much. Like, she shouldn't be stressed, she shouldn't cry very much, and that's why the close circle of people does tiptoe around her to make sure she's calm and happy, because when she's stressed, this might trigger a seizure or some other problem. However, people on outside her family, they do not treat her differently.
So what are your thoughts on epilepsy?
Well, it's of course a very serious disease, unfortunately, a very big neurological disorder which can strike someone very suddenly. And unfortunately, the real causes of it are not confirmed as of now. There are different scientific theories about where epilepsy comes from. It can be from the relatives, genetically. This is one of the theories that I'm aware of, and it's not necessarily direct relatives like parents or grandparents. It can be somewhere else in the family tree. However, there is also a theory that vaccination can trigger those seizures, and this is something that the baby's mom thinks was the reason, because this very first seizure started after the child had a joint dose of DTaP and some other vaccines. So the doctors do not support this theory. When they hear parents complaining that this child started having seizures as a result of the vaccination, they say, oh, it was a coincidence. So it's really not known who is right or wrong here. Apparently people who are scientists and who studied this disease can relate more on the possible causes of epilepsy, but of course it's very serious problem which has to be treated and treated right. I think the biggest challenge is to diagnose a person correctly and prescribe the correct treatment. Because unfortunately, as I've seen with this little girl from my mom's experience, treatment of epilepsy is a huge experiment. This girl was put on a very strong medication right when the seizures started at the age of 4 months, and the doctors were convinced that this was the right medication, that they put most of epileptic kids on this medication. However, now, as she is 3.5 years old, the doctor she is currently observed by has decided to take the child off that medication that she's been taking for almost 3 years and prescribe some other one. So it's a constant process of trial and error. They're prescribing different things, they see things improving or not improving, they prescribe something else. The family has been very exhausted by all these consultations from different doctors and by trying different types of treatments, but it seems like there's no other way. You have to try until you see things working. Also, unfortunately, epilepsy in this particular case is stopping the correct speech development of the child, and the girl has been experiencing speech problems. She is not talking normally yet at 3.5 years old. She's going through many different speech therapists and occupational therapists and different types of medicated and non-medicated treatments in order to help support her and ensure she's developing the best she can at this point in life. Therefore, of course, it's a big challenge for any family who has to deal with the disease like epilepsy. I can only wish families who struggle with this wish for them to really find a high professional qualified help, because this is something one cannot fight on their own.
I completely agree with you. Thank you very much for doing this interview with me.
You're very welcome.
Know that some world famous people had epilepsy. For example, Danny Glover, Lil Wayne, and the Prince. And can you even believe it, the 26th United States President Theodore Roosevelt? As I have already mentioned, more than 50 million people suffer from epilepsy, and now I hope you are more informed to connect with them. Thank you for watching, and see you next time.